The top stories tonight in Y News. The presence of the COVID-19 Delta variant has already been seen in 9 regions in the Philippines, but more cases may have been undetected.
As fatalities surge, COVID-19 cadavers overwhelm a crematorium in Iloilo City. Local officials in Aklan are looking for possible COVID-19 burial grounds.
As patients flood in, several hospitals in Metro Manila are now nearing their full capacity. The Philippine National Police will launch a crackdown on possible hoarders of medical supplies, including oxygen tanks, amid the surge of COVID-19 cases.
Government offices in Metro Manila to operate during the ECQ period, but with limited workforce.
And officials in Wuhan, China order a mass testing for COVID-19 on residents. Good evening, Philippines and the world. Today is Wednesday, August 4, 2021. I am Herlene Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. More local cases of the COVID-19 Delta variant is recorded in the Philippines. 9 out of 17 regions now have cases of the more transmissible variant. But health experts say more Delta variant cases could have gone undetected. Aiko Miguel explains why.
There are 165 local Delta variant cases in the Philippines based on the record of the DOH Epidemiology Bureau. Local cases are recorded in the Ilocos region, National Capital Region, Central Luzon, Calabarzon, Central Visayas Region, Eastern Visayas, Western Visayas, Northern Mindanao, and Davao.
Nakakatakot po, pero with correct messaging, we can alleviate the panic, the fear that the people and all sectors are experiencing because of this.
Currently, there are 216 Delta variant cases in the Philippines. 17 are active cases, 190 have recovered, and 9 succumbed to the Delta variant. According to the DOH, the Beta variant first discovered in South Africa are still the dominating variant in the Philippines. Also, according to experts, there may have been undetected Delta variant cases because of the limited genome sequencing capacity in the country. According to Dr. Althea de Guzman of the DOH Epidemiology Bureau, the country remains at moderate risk classification, having 50% of the health system capacity being utilized. For Presidential Advisor for Entrepreneurship Secretary Joey Concepcion, the implementation of ECQ in the NCR is timely as the cases due to Delta variant did not yet reach its peak.
It's a challenging situation, and let's not wait, because if we wait too long, then we will be up for something more challenging. I felt that we have to act immediately. Looking at it on a larger perspective, what we are really trying to do is protect our fourth quarter. The fourth quarter for most MSMEs and large corporations is the quarter when momentum really builds up. We know that this is the Christmas season, so consumer spending is at its highest. And of course, the election spending by then would have started to kick off. So this is the best time for many entrepreneurs who are losing money in the previous quarters to be able to recover it.
Authorities once again requested the public to be responsible and stay at home with the enforcement of a 2-week ECQ in the country. According to Cabinet Secretary and IATF Co-Chair Carlo Nograles, if the government succeeds to slow down the transmission, this could be the last hard lockdown implemented in Metro Manila.
Yun din yung taimtim naming nais mangyari, na sana huli na itong ECQ natin at magtuloy-tuloy na. Ngunit mangyayari lamang ito kung lahat tayo tutulong, kung lahat tayo ay kusang loob na kikilos ng naayon sa inaasahan mula sa kanila bilang mga kabahagi ng kabuuang pagtugon.
According to Department of the Interior and Local Government Secretary Eduardo Año, the country's situation could be better after the lockdown once Delta transmission is caught.
We go on the lockdown for 2 weeks, not only to save the lives of our fellow Filipinos, but also to save the economy for September, October, November, December. Kumbaga, parang sacrifice tayo ngayon para maisalba natin at magkaroon tayo ng magandang economic activities after this lockdown.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Local government units in Iloilo Province have been instructed to identify possible burial sites for those who have died from COVID-19 amid the surge of cases. Nina Armillo reports why.
The Hegato Abesia Funeral Parlor and Crematorium in Barangay Balubago, Haro, Iloilo City has temporarily stopped accepting cremation service requests. The crematorium is the only facility licensed by the Department of Health to cremate persons who died from COVID-19 on Panay Island, which consists of Aklan, Antique, Capiz, and Iloilo provinces. According to Feli Abesia, the funeral owner, they will continue their operations to cremate the cadaver backlogs.
Wala kami nag-stop ng operation, kundi ang acceptance lang sa mga cadaver nga halin sa outside of the city. Ginakuan ko lang ginatagaan ko anay isang chance, gave me a week or two to finish all of this nga i-cremate ko.
The funeral also plans to buy a new machine that can cremate 60 to 80 cadavers. Under the DOH pandemic protocols on the handling of cadavers, the dead must be buried or cremated within 12 hours. With the unavailability of crematory services, immediate burial is the only option. Meanwhile, 17 towns of Aklan Province are told to prepare burial grounds for additional COVID-19 deaths.
Nagbigay din ako ng advice sa ating mga mayors na in case na may mga COVID deaths tayo dito sa Aklan, dapat ready yung kanilang mga municipal cemeteries na mag-receive nito, yung madibing kaagad.
Over the past week alone, Aklan recorded an average of 2 to 3 COVID-19 deaths per day. Due to increasing cases and deaths, Aklan is now under modified enhanced community quarantine until August 15. Nina Armillo, UNTV News and Rescue. We serve the people. We give glory to God.
The Philippines logged today 7,342 new cases of COVID-19, bringing the nationwide tally to 1,619,824. Data from the Department of Health showed that the number of active infections in the country has reached 63,171. Of these, 94.1% are mild, 1.3% are asymptomatic, 1.42% are moderate, 2% are severe, and 1.2% are in critical condition. The DOH noted in its report that 7 accredited testing laboratories were unable to submit data on time, and 1 laboratory did not operate on August 2nd. The DOH also reported 7,285 more recovered patients, pushing the total number of recoveries to 1,528,422. COVID-related deaths, however, rose to 28,231 with 90 new fatalities. Data from the DOH also showed that 61% of the country's ICU beds are occupied and 41% of ventilators are being used. In the National Capital Region, 59% of the ICU beds are occupied, while 42% of the ventilators are in use. COVID-19 referral hospitals in Metro Manila will soon limit the admission of coronavirus patients. Ray Pelayo explains why.
Some major hospitals in Metro Manila has been seeing a consistent increase of COVID-19 patients in the previous weeks. At the National Kidney and Transplant Institute or NKTI, the COVID-19 ward is fully occupied with a total of 131 patients. Some patients are still on queue and are staying inside the emergency room. Dr. Rosemary Liquete, NKTI's executive director, said if patients continue to flood, they will soon limit admissions to those with kidney problems.
Malaki na ito, malaki na because we are worried na mapupuno na naman ang aming emergency room at saka sa room sa itaas, that we may have to limit admission sa mga renal patients lamang na may COVID. Kidney patients may COVID kasi wala kaming paglalagyan na.
In the Philippine General Hospital or PGH, from its 225-bed capacity, 154 COVID-19 patients are already admitted. What is notable, according to PGH spokesperson Dr. Jose Jonas Del Rosario, most of the COVID-19 patients are unvaccinated.
Yung pong mga nasa hospital po sa PGH ngayon, 85% po ay unvaccinated po. At lahat po nung nasa ICU ay unvaccinated. Kaya ibig sabihin po ay talagang kung hindi ka bakunado, mas malamang severe ang maranasan mo na COVID.
Meanwhile, the Tala Hospital in Caloocan City is only accepting non-COVID-19 patients until Friday. The hospital plans to expand their COVID-19 wards to accommodate more patients. In these three hospitals, a number of healthcare workers still contract COVID-19 but not as many as the previous weeks, and their conditions are milder. Hospital administrators believe that the vaccination of medical workers somehow helped in the situation. Based on the contact tracing conducted among healthcare workers in Tala Hospital, it appeared that they were infected outside their workplaces.
Alam mo na kung anong ginagawa sa labas, di ba? Magpa-party, pupunta ng palengke, mga family gatherings, yun ang most common na mga reasons on why maraming healthcare workers ang nahawa ng COVID-19.
Meanwhile, private hospitals say their bed capacity are now on high risk.
Hindi pa naman karamihan yung critical occupancy rate, Medyo ang karamihan ngayon ay nandun pa tayo sa mga high risk. Ibig sabihin less than 80% pa lang ang mga occupancy ng mga ibang hospitals.
Hospital management are appealing to the public to cooperate with the implementation of enhanced community quarantine to be able to help curb COVID-19 infection. Ray Pilayo, UNTV News and Rescue. We serve the people. We give glory to God.
2 days before the implementation of the hard lockdown in Metro Manila, several local government units have started distributing quarantine passes to residents. JP Nunez will give the details live. JP, how many quarantine passes are allocated or allowed per household?
Yes, Diego, strictly one quarantine pass per household is allowed so that a designated person can have access to essential goods. Metro Manila mayors unanimously decided to reimpose the quarantine passes in Metro Manila to limit the mobility of residents to avoid the possible spread of COVID-19, especially there is a threat of Delta variant. This will be used for 2 weeks starting this Friday. San Juan City LGU visits houses in the city to distribute new quarantine passes to its residents.
Ang ating mga quarantine passes po ay papamahagi simula ngayon hanggat bukas sa iba't ibang barangay. Manatili lang kayo sa inyong mga bahay, huwag niyo puntahan ito sa barangay hall. Ang barangay officials po natin na magdadala sa inyo, 1 quarantine pass per household po.
According to the City LGU, they will be distributing 40,000 new quarantine passes. The old quarantine pass may not be used.
Tandaan natin yung mga qualified naman na magtrabaho sa kasagsagan ng ECQ ay hindi na kailangan ng quarantine pass. So there's no reason to go beyond one person per family. Kung ang layunin naman ng paglabas ay bumili ng pagkain at gamot, pwede naman gawin yan ng isang tao lamang.
Meanwhile, the Manila City LGU also started distributing quarantine passes to be issued at the barangay offices. In a memorandum issued by the Manila Barangay Bureau, old quarantine passes may still be used. Odd and even scheme in markets will also be reimposed to limit the number of residents going out. Other LGUs that implement new quarantine passes are Parañaque, Valenzuela, and Quezon City. Diego, authorized person outside of residence or APOR and those with vaccination schedule may still go outside during the ECQ period provided that they will bring their IDs and vaccination schedule. That is our latest live. Back to you, Diego.
Thank you for that report, JP Nunez. The Philippine National Police will run after individuals who would be identified engaging in hoarding of medical supplies amid the continuing threat of COVID-19. Leia Ilagan reports why.
Philippine National Police Chief Police General Guillermo Eleazar has ordered an investigation into the possible hoarding of oxygen tanks and other medical supplies amid the continuing threat of COVID-19 pandemic. Eleazar issued the order after Cebu City Vice Mayor Michael Rama called on the police and the DTI to look into the supposed hoarding of oxygen tanks. Eleazar said the PNP would also check if there are incidents of hoarding of oxygen tanks and other medical supplies in the National Capital Region and other parts of the country.
Kasama sa aking utos ang pagsampa ng lahat ng pwedeng ikaso sa mga tao na mahuhuling gumagawa nito.
The PNP chief also urged the public not to hoard as it would affect those who really need it.
This kind of illegal activity puts the lives of our other kababayan who need them in serious risk.
Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
And for those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook. A former advisor of the government's task force against COVID-19 worries that the upcoming hard lockdown will not significantly address the growing number of COVID-19 cases in Metro Manila due to the more transmissible Delta variant. Arlene Delgado will tell us why.
With only 2 days away from the implementation of the strictest form of quarantine in Metro Manila, former National Task Force Against COVID-19 advisor and health reform advocate Dr. Tony Liachon doubts if the enhanced community quarantine will bear successful results in fighting the Delta variant. In an interview with Politiscoop, Liachon says he does not believe in lockdowns in solving the crisis, especially with the rate the government's COVID-19 response is going. He cited the lack of COVID-19 testing, slow contact tracing, and slow vaccination. Liachon also expressed concern on the positivity rate in the country, which is at 17.5%, way higher than the average 5%. The former task force advisor fears if the government will not act urgently, the lockdowns might persist, which will greatly hit the poorest of the poor.
Kapag ayuda, delayed ang data management. So, ang daming dapat ginawa noon pa. And how sure are we na gagawin ito ng Department of Health at saka ng IATF kung noon ngang ordinary times na hindi Delta variant ay hindi ginagawa?
Liachon suggests to the government to be proactive in its response. For one, providing an immediate free COVID-19 testing for essential workers who have no capacity to pay. Another is to focus on prevention to help decongesting hospitals, which would also help the Philippine Health Insurance Corporation or PhilHealth to bleed less money.
Pag hindi naging successful ang testing at tracing nito, mag-i-extend ka ngayon ng ECQ mo. Yan ay hahaba yan ng mga 1 buwan. Depende sa pag-respond natin. So hopefully hindi mangyari yan. Tomorrow kagad, mag-declare kagad sila ng free testing. Kung may ayuda sila, may libre silang testings, I think magiging successful. Pero dapat magawa yan within 1 week.
Liachon hopes that the government will not wait for the total collapse of the country's health system before changing its ways, and that a change in leadership will soon be realized. Harleen Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
The government can now expand its genome sequencing, which identifies the type of variant a coronavirus positive person has been infected with. Meanwhile, the Department of the Interior and local government is seeking for additional funds for contact tracers. Nel Marie Buhok explains why.
The funds needed to boost the sequencing effort of the Philippine Genome Center is now available. This is according to Department of Health Secretary Francisco Duque III during today's hearing of the House Committee on Health.
The DOH has already downloaded about 220 million pesos for additional test kits and human resource augmentation for the Philippine Genome Center.
Dr. Cynthia Saloma, Executive Director of PGC, said that if they have enough funds to improve their facilities, they can double their sequencing capacity.
We are able to sequence 750 a week. With added automation, we can do 1,550 a week. But to answer concerns for samples coming from Mindanao and Visayas, where we want to have faster turnaround time, we are capacitating. If the DBM will download money to us,
Saloma also appeals to government to progressive and not reactive on the COVID-19 Delta variant situation.
Hindi po siya dapat i-consider as point of care diagnostics. Pag sinabi ko pong point of care diagnostics, huwag mo nang hintayin yung result bago kayo mag-act, whether Delta o hindi. Ang main purpose po ng ating Delta, ating whole genome sequencing is we want to know narito na ba siya sa atin, saan ba siya nanggaling, so that we can inform policy.
Meanwhile, the Department of Budget and Management is sourcing out funds to support and hire more contact tracers. According to Department of the Interior and Local Government Undersecretary Epimako Densing, the current funds to maintain 50,000 contact tracers are now depleting.
So kung makakakala po tayo na another 5 to 7 billion, may extend po natin ang ating mga kontrata sa contact tracers until December. Not to mention that we can also increase the number of contact tracers that the LGU is able to hire to back from 15,000 back to around 50,000.
Densing appeals to local government units to abide in the budget circular regarding the realignment of local government funds that can be used in the COVID-19 response. Contact Tracing Czar Benjamin Magalong reported that the contact tracing efficiency ratio in Metro Manila has improved.
There's also a huge improvement in the part of NCR, which registered a 1:7 contact tracing efficiency ratio. The lowest is BARM, and they have been very consistent with this.
Government officials reiterates the need to implement the strict enhanced community quarantine in Metro Manila.
What we're seeing in Cebu and what we are seeing now in Cagayan de Oro and what we are seeing in Mangoog, nakita natin talaga na ibang klase ito. So ang nakita natin dito is if we will not declare ECQ sa NCR, we will be next India. Indonesia, ma-experience po natin yan.
Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
Government offices in the National Capital Region will be allowed to operate during the 2-week ECQ period, but with a limited capacity. Rosa Licos reports why.
To combat the potential COVID-19 surge due to more transmissible Delta variant, the coronavirus restrictions over Metro Manila will be tightened starting on Friday. The government will place the capital under enhanced community quarantine. To ensure continuous delivery of public services during the period, the government agencies and instrumentalities under the executive branch in the National Capital Region will remain fully operational. However, the government offices, including government-owned or controlled corporations, will be subjected to not less than 20% on-site capacity. They will only have a skeleton workforce on-site, and the remainder shall be under work-from-home arrangements. Agencies providing health and emergency frontline services, laboratory, testing services, border control, and other critical services shall be allowed up to full on-site capacity. Meanwhile, Malacanang encourages the offices under the legislative and judicial branches of government, as well as independent constitutional commission and local government units, to adopt the 20% on-site capacity. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
And for the news abroad, Wuhan, the ground zero of the 2019 COVID outbreak, will conduct a mass coronavirus testing as the Delta variant begins to dominate. Marvy Delfin will give us the details live. Go ahead, Marvy.
Kath, Chinese authorities have announced to begin testing Wuhan city's entire population of 12 million residents after detecting its first locally acquired COVID infection in more than a year. According to city official Li Xiang on Tuesday, this is to ensure safety after the city recorded 7 local cases linked to the more transmissible Delta variant found in Jiangsu province. According to officials, this surge in infection started in the Jiangsu province's capital Nanjing, where the Delta variant was most likely brought by a flight from Russia. As part of the efforts in controlling the current COVID situation, China has canceled the Basketball League games and suspended its flights and trains. The nation is currently detecting a spike in COVID infections as 19 new cases are recorded on Tuesday, with over 61 locally transmitted. Kath?
Marvy, how did the Wuhan residents respond to the current COVID situation in their city?
Kath, China has been successful in controlling the virus previously with quick lockdowns and isolations. However, this time, the new cases have been confirmed to spread in several cities. That is why, according to local reports, this outbreak sparked panic buying to Wuhan residents for fear of being forced back to lockdown. Back to you, Kath.
Thank you, Marvy Delfin, for that report. The U.S. Centers for Disease Control and Prevention has issued a ban on rental evictions as the Biden administration faced criticism from progressive Democrats. Mavian Dog will give us the details live. Yes, Maeve?
Kath, the new ban announced on Tuesday could help millions of tenants in the United States who have not been able to pay their rent during the pandemic to stay in their homes. The announcement came as coronavirus cases linked to the Delta variant in the country continue to increase. According to the CDC, the ban applies to counties with high levels of community transmission, covering most of the U.S. population. U.S. President Joe Biden said the ban would give more time for renters and landlords to get financial assistance through the federal aid program. The announcement at the White House was seen as a reversal for the Biden administration, which has been criticized by Democratic legislators for allowing a previous eviction ban to expire over the weekend. President Biden expressed his doubts on whether the new ban could withstand lawsuits regarding its constitutionality. Here is what he said about the moratorium.
The bulk of the constitutional scholarship says that it's not likely to pass constitutional muster. But there are several key scholars who think that it may, and it's worth the effort. But the present, the court's already ruled on the present eviction moratorium.
The Biden administration are reassuring the Democrats and U.S. citizens that they are finding ways to minimize the damage being caused by evictions through the federal aid and speeding up the distribution of rental relief. Back to you, Kath.
Thank you, Mavian Dog, reporting live from Australia. U.S. President Joe Biden has called on the governor of New York State, Andrew Cuomo, to resign after an independent investigation found that the governor had sexually harassed women. Justin Masakayan reports.
U.S. President Joe Biden called on New York Governor Andrew Cuomo to resign after independent investigators found that the governor sexually harassed multiple women.
Are you now calling on him to resign?
Yes.
And if he doesn't resign, do you believe he should be impeached and removed from office?
Let's take one thing at a time here. I think he should resign. I understand that the state legislature may decide to impeach. I don't know that for fact. I've not read all that data.
In the investigation released by New York Attorney General Letitia James, 179 individuals were interviewed, including complainants, current and former members of the executive chamber, state troopers, additional state employees, and others who interacted regularly with the governor. Documents, texts, emails, and pictures were also reviewed as evidence. The investigation was commissioned last year after several women came forward with allegations. Sexual harassment included unwanted and inappropriate groping, kissing, hugging, and comments that accusers called deeply humiliating, according to the report. In a response video posted on YouTube, Governor Cuomo denied the harassment and called on the public to go to his website and see the response his attorney has made about each allegation.
I want you to know directly from me that I never touched anyone inappropriately or made inappropriate sexual advances. I am 63 years old. I've lived my entire adult life in public view. That is just not who I am. And that's not who I have ever been.
Justin Masakayan, UNTV News and Rescue, USA. We serve the people, we give glory to God.
And those are the reasons behind the news in other parts of the globe. I am Kat Dumaraos, live from Bangkok, Thailand. Good evening.
The operation of tricycles during the ECQ period will still be allowed in Metro Manila, but only one passenger can ride a tricycle per trip. Asher Kadapan Jr. will tell us why.
Public commuters in Metro Manila will need transportation while it is placed under enhanced community quarantine. This is why Metro Manila mayors unanimously agreed to let the operation of tricycle continue during ECQ. Department of the Interior and Local Government spokesperson Undersecretary Jonathan Malaya explains that such public conveyance will only be allowed to accommodate just one passenger.
Well, sa meeting namin kahapon with the NCR mayors, it was agreed na we will allow the operation of tricycles during the ECQ. So, ang condition lang na binigay ng DILG is only one passenger per tricycle.
Malaya further explains that tricycle operation would be vital in the intensified vaccination activities across the National Capital Region in the next 2 weeks.
Ginawa natin to dahil meron nga tayong vaccination program na mangyayari during the ECQ. At yung mga frontliners natin need to report sa mga ospital, so kailangan ng public transportation.
The DILG, however, clarifies that the same fare matrix issued by the local government units should be followed in every tricycle trip. Tricycle drivers, on the other hand, prefer to adhere to the given tariff as increasing them may drive passengers away.
Ay, hindi na siguro sila papayag kung isa lang ipataas ang pasahero. Baka hindi na sasakay. Hindi na sasakay yan. Maglalakad na lang.
Okay lang sir, basta ihiling ng lamin yung hindi mapatigil ang biyahe.
Eh kulang kami sa kita tsaka yung pagkain namin Nagugutom kami mga tricycle boy Ang kailangan namin ayuda.
Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Since the Philippine government's COVID-19 vaccination program began in March, only 32% of senior citizens in the country have been fully vaccinated against COVID-19. The Department of Health also reports that majority of the COVID-19 fatalities in the Philippines involves senior citizens. Marvin Calas explains why.
Suggestions from loved ones and close friends are of great help in convincing senior citizens getting vaccinated against COVID-19. According to the Department of Health, it is in addition to various methods the local governments has been implementing to persuade more senior citizens to get vaccinated. In spite of these, a large number of A2 priority group still needs to get vaccinated amid the threat of the Delta COVID-19 variant in the country.
Mahalaga din po na alam natin na ngayon lumalabas po sa ating mga datos na ang mga senior citizens, nakikinig po talaga sila sa mga taong malapit sa kanila, no? So it could be family, friends, no, na nabakunahan nila, mga fellow senior citizens, kamadyong ba nila yan, kasama nilang mag-chest, at mga physicians or healthcare providers na malapit din po sa kanila.
As of August 1, more than 2.6 million senior citizens are fully vaccinated, while more than 2.8 million are vaccinated with first dose. The National Commission for Senior Citizens helps the DOH in strengthening the vaccination program. The group informed that many of their members wants to get vaccinated, but the struggle is that many areas has a limited vaccine supply.
We understand kasi na ang inuuna ngayon ay ang Metro Manila at ang mga lugar na may medyo mataas ang rates ng COVID. So in which case, maraming nagrereklamo po sa mga areas na medyo hindi pa nabibigyan ng bakuna dahil nga po hindi pa dumarating ang mga bakuna. We would like to assure you na marami talagang senior citizen na gustong magpapakuna. Ang problema nga lang, hindi pa dumarating yung supply dahil nga may mga priority areas.
The group appeals for the national government to inform organizations and senior citizen groups about the arrival of vaccines in order for vaccination centers to immediately schedule its vaccination. In Metro Manila, almost 63% of senior citizens included in the master list are fully vaccinated, while about 68% are vaccinated with first dose. The Health Department agrees with the suggestion of the World Health Organization to intensify vaccinating senior citizens, especially now that majority of Filipinos who die in COVID-19 are the elderly.
Alam po natin na talaga po all those people more than 60 years old, they actually account for more than 60% po ng mga namamatay sa COVID-19 dito sa ating bansa. Yung percentage po ng namamatay na senior citizens tumataas habang tumataas po yung kanilang edad.
Vaccinating senior citizens and those with comorbidity was previously recommended by the WHO to help reduce hospitals getting overwhelmed by patients with severe cases of COVID-19. Marvin Calas, UNTV News and Rescue. We serve the people, we give glory to God.
The Commission on Elections is confident that the current COVID-19 pandemic situation in the country will not affect the majority of votes of the Filipino electorate in the 2022 national elections. Dante Amento tells us why.
Commission on Elections spokesperson James Jimenez believes that government's efficient response and high number of inoculation against COVID-19 will encourage more Filipinos to participate in 2022 elections. Based on data from the National Vaccination Operations Center of DOH, as of August 2, a total of 21,210,129 doses of COVID-19 vaccines have been already administered. Jimenez stresses they consider the current situation as a challenge to look for better solution that will allow safe elections.
While we take them, we accept them gratefully, sa atin, paalala lang yan. Paalala na dapat pagtingin pa natin yung effort. Hindi yan hudyat para mag-give up na. Okay? Kasi yun ang pinupunto ng iba eh. Dahil natakot tayo ngayon, give up na tayo for 6 months later.
Jimenez added the recent survey by Pulse Asia which showed nearly 50% of the respondents will not vote if the number of COVID-19 cases in their areas remains high, will probably change as more individuals are getting vaccinated and slowly learn how to live amid the COVID-19 pandemic.
The most important thing to remember here is that surveys are snapshots in time. Talagang dyan lang siya. Dyan lang siya relevant. Ang tagal na ng COVID na to, and we have a very excellent response from the government, di ba? Nagre-respond tayo na maaga. So I think by the time na magka-election tayo, more than 6 months away, humupa na ng konti yung fear. Mas alam na natin kung paano i-manage. There will be no reason for people not to feel safe.
Comelec believes Filipinos' desire to maintain the democracy in the country remains by choosing their trusted future leaders. In fact, amid the health crisis, Comelec has surpassed the 60 million targeted registered voters.
Ang ating halalan po ay ating pagkakataon upang makialam sa ating demokrasya. Huwag nating sasayangin yung pagkakataon na yan.
Even 2020 Tokyo Olympics gold medalist Heidi Diaz has encouraged particularly the youth to exercise their right of suffrage.
Sa lahat po ng kabataan, magrehistro na po. Kailangan nyo pong i-exercise yung rights nyo as Pilipino. Kailangan nyo pong magrehistro para makaboto. Then, kung makaboto na kayo, piliin nyo po kung ano ang sa tingin nyo ang tama na may good values or ano yung sa tingin nyo na same values as you.
Comelec is expected to sit down with DOH to talk the necessary health protocols in the upcoming polls. These protocols may be released before the filing of the Certificate of Candidacy or COC in October. Dante Amento, UNTV News and Rescue. We serve the people. We give glory to God.
Tropical Depression Goryo has slightly intensified as it exited the Philippine area of responsibility this afternoon. State Weather Bureau Pagasa said as of 5 p.m., the center of Goryo was located at 800 kilometers northeast of extreme northern Luzon, outside the Philippine area of responsibility. It has maximum sustained winds of 55 kilometers per hour near the center and gustiness of up to 70 kilometers per hour while moving northeast at 15 kilometers per hour. Due to the influence of the southwest monsoon, heavy rains will be experienced in the next 24 hours over Ilocos Region, Cordillera Administrative Region, Batanes, Babuyan, Zambales, and Bataan. Pag-asa adds coastal and upland localities in northern and western Luzon will experience occasionally gusty conditions associated with the enhanced southwest monsoon. Currently, no tropical cyclone wind signal is in effect. Goryo is forecast to intensify into tropical storm in the next 12 hours and will move northeastward towards southern Japan. After 24 hours, it will turn more east-northeastward, moving further away from the Philippine area of responsibility. And before we close, we will leave you with a final word, giving glory to God. From the book of Jeremiah, chapter 10, verse 23, it says, O Lord, I know that the way of man is not in himself. It is not in man that walketh to direct his steps. And those are the reasons behind the news, August 4, 2021. I am Herlene Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.